Hi, my name is Robin. I'm going to be your nurse today. You're here for a physical assessment. Can you tell me your name and date of birth?
Becky Moss, 8/15/1974.
Great. I'm going to wash my hands 20 seconds for the CDC. I'm going to pull the curtain for privacy and look around and make sure nobody's in here. If they are, I'm going to address them as well as you. I'm going to check your wristband against your name and date of birth. Can you tell me if you have any allergies?
No,
Okay. And where are you right now?
in the hospital.
In the hospital. And what are you here for?
A checkup.
Very good. And the date?
The 27th of May.
Okay. And who's the president?
Joe Biden.
Very good. Thank you. Alert and oriented ×4. Do you have any pain?
No.
Nowhere in your body? You don't feel anything radiating? Great. And I'm taking a look at your head and neck, and so I'm going to assess your skin, color. You're nice and tan. Do you have any bruising, any recent surgeries that you've had? No, nothing? Okay, I'm going to take my hands. I would have clean hands. I'm going to check your scalp. I'm going to palpate for any lesions. Everything feels good. Nothing there. I would check for warmth, edema. No warmth, edema, anything like that. I don't see any bruising, no lesions, nothing like that. I'm going to take a minute and check your mouth, your nose, and your ears. But how are you doing today?
Good.
Very good. Okay, so I'm going to take a look in your ears. I'm going to use this here, look. And I'm going to take a look in the other ear. Very good. So the tympanic membrane is nice and translucent, and it's got a grayish color to it. It's not swollen or red. If you'll open your mouth for me, I'm going to take a look in your mouth. Very good. Your mucosa is nice and pink and moist. Your tonsils are +2. I can see them very well. I'm going to take a look in your nose. If you look up, one nair at a time, everything looks good. I don't see any deviated septum, no perforation. Everything looks very normal there. I'm going to take a look at your neck. I'm going to palpate here. I'm looking for your trachea to be midline. I don't see any lesions, anything like that. You're nice and warm. I don't feel a hardened or distended goiter, which is your thyroid. Your throat, neck, everything looks good. No bruising, nothing like that. I'm going to palpate your lymph nodes. So I'm going to use my fingers. I'm going to come in. I'm going to palpate post-auricular, occipital, preauricular, tonsillar. I'm going to come down to the cervical deep and go mid. All 3 cervical chains. I'm going to go to your clavicular here. Submandibular, submental, and those are your lymph nodes to be palpated. I'm also going to auscultate your carotid arteries after I palpate them one at a time. Nice and strong. 15 seconds. I'll do the same thing over here. Very good. Now I'm going to auscultate using the bell. I don't hear any bruise, no notable sounds. Very good. I'm also going to check your carotid with your radial. So if you'll open your hand and relax. Very good. Nice and even, symmetrical. Perfect. Very good. Okay. Now if you'll turn your head to the left. Very good. I'm looking for JVD, jugular vein distension. Nothing notable. I can't palpate the jugular vein. I don't see any throbbing, so everything looks good there. Thank you very much. Now I'm going to move forward with your cranial nerves. So we have 12. I'm going to start with cranial nerve 1. If you'll close your eyes and close one nostril, and you're going to smell, and tell me what you smell.
Is eucalyptus.
Very good. Close the other nostril and take a smell.
Strawberries.
Very good. Thank you very much. And now the CNA had checked your vitals earlier as well as your vision. Everything was normal, within normal findings. Your blood pressure, everything was good. There was nothing of note there. I'm going to check for your pupil response. So typically that's called perla. Your pupils are round, they are reactive, they are equal in size, and they are reactive to light accommodation. So that would be your cranial nerve 3. And then 3, 4, and 6 are cardinal fields of gaze. If you'll follow the tip here, I'm going to make an H pattern. So you're going to come up, down, middle, here, here, and then back to the middle. Very good. Now for cranial nerves 5 and 6, can you smile? Lift your eyebrows. Blow a puff of air. Good. And close your eyes for me. Can you feel this? Which side of your face? Very good. Can you feel this? Very good. Next. For the cranial nerves 8, I'm going to have you stand up and put your hands to your side and close your eyes. This is the Romberg Test. Very good. Have a seat. Okay, now we're going to do a whisper test. So close this ear here. I'm going to whisper a word. Tell me.
Dog.
Very good. I'm going to come to this side. I'm going to whisper a word. Close your ear here.
Dog. Dog.
Very good. Both were within normal findings. Now, can you swallow for me? Good. Open your mouth. Have a gag reflex. Very good. And your tongue, can you stick your tongue out? Very good. That is cranial nerves 4, 5, and 7. So trapezius, I want you to lift your, yep. Now I'm going to apply pressure. Lower your traps. Lift against pressure. Very good. Now for walking, I would have you stand up, walk to the bench, and walk back. Very good. Everything looks symmetrical. Have a seat. Gait is normal. And your upper and lower cerebral function. So can you do this? Patty cake. Quickly. Very good. Fingers. Here, 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 here. Very good. And then lay back on your back and do your heel. This left heel to your right shin. Yep. And then right heel to the left shin. Very good. Thank you very much. Okay. You can sit up. Okay, I'm going to assess your chest and your arms. This is upper body. Everything looks very symmetrical, good muscle development. I don't see any lesions. I can feel, you feel nice and warm on both sides. No edema that I can tell. If you had any surgeries recently, anything like that. Okay, good. Symmetry is good. Thoracic cage, I am going to look for deviation, configuration. Everything looks, again, normal, within normal findings. I'm going to check the respiratory expansion. So I'm going to take my hands and I want you to just breathe normally. Great. Good. And then I would have you shift to the back. I would come around the back. I would go down here. Breathe normally. Great. Everything is very symmetrical. Awesome. So with your arms, range of motion, can you lower your hands to your side and flex? Good. Again. Very good. That's flexion and extension. And then I'm going to have you put your hands straight out, lift. Good. And then here, push down. Great. And grip. Good. Good strength within normal findings. I'm going to test your reflexes. So deep tendon reflexes is tricep, bicep, and your brachioradialis. So here, we're going to check the bicep. Very good. Tricep. Very good. And brachioradialis. Great. Okay. So we'll do here, here, and here. Very good. Okay. Capillary refill. We're going to check your fingers. Here you don't have a nail. Say we don't have a nail. We're going to press and release less than 3 seconds with this normal finding. Very good. Excellent. Can you grab my hands and squeeze again? Great. Now I'm going to check your brachial and radial pulse together. I'm going to come up here and I would count for 30 seconds. Even, strong, consistent. Very good. Okay, now we are going to assess your chest. So, and your heart and lungs on bare skin. So I would auscultate over bare skin. I'm going to check heart sounds. So apical is second intercostal space, right of the sternal border. Pulmonic is second intercostal space, left of the sternal border. Erb's point. Bell, third intercostal space, bare skin, left of the sternal border. Tricuspid, fourth intercostal space, left of the sternal border. And mitral would be here. Fifth intercostal space, lean back, left of the sternal border, mid-clavicular line. Great. And then I'm also going to assess the apical pulse, which is mid-clavicular line, underneath the nipple, left of the sternal border. And I would count with the patient leaning forward for 1 full minute. Excellent. Okay. Very good. And then pattern and rhythm look normal. The chest is rising and falling equally. So I'm going to auscultate the breath sounds. I'm going to start, there's 12 points, landmarks. I would start here. And then I would auscultate for the left lobe, 2 places laterally, here and here. For the right lobe, or right lung, 3 lobes, 1, 2, 3. Great. I would have the patient lean forward. Let's see here, 12 points of interest. And I was looking for overall skin also on the back, so I would look for lesions, any bruising. I would check for warmth, edema. Everything looks very normal. Good. Okay. I'll have you lay back here. And I'm going to lift your shirt for your abdomen here. I'm going to check the skin for any ascites, any swelling, inner tenderness, anything like that, bruising, warmth, edema. I'm also going to auscultate in the 4 quadrants. I'm going to start with the lower right, upper left, lower left, and I'm going to listen for a minute. If I don't hear anything, I would listen for 5 minutes in each quadrant. I hear irregular, high-pitched gurgling sounds, very normal. I'm going to auscultate the abdominal arteries with the bell for 1 minute. Very good. Can you tell me about your last bowel movement?
Was this morning normal and fine?
Normal and fine. So color,
Brown.
odor, normal,
Same.
consistency. Okay. Amount seems normal to you.
Yeah.
Okay. And urine. When did you urinate last?
About an hour ago.
An hour ago. Okay. And color.
Normal.
Okay. Like light yellow.
Yes.
Okay. Amount. Normal amount to you.
Normal,
Would
yeah.
you go any like color, like, or any different consistency, like blood in it, anything like that?
No, it was almost clear.
Any odor to it? Okay,
Very
very good. I'm going to percuss. Okay, and then I'm going to palpate. So I'm going to palpate here, light. Feel anything?
No.
Yeah.
No. No.
And then I could do deep palpation here. Very good. Okay, awesome. And I'm going to now have you pull this down. I'm going to check your lower extremities. So I would lift your, here, I would expose you. I'm going to look at your overall skin, any bruising, scarring. I would check for edema, pitting edema, if you had any of that. Have you had any surgeries recently? Any pain in your legs? Okay, great. I would check your pulses here. So and then I would check here together. Great. And I'm going to have you do range of motion. So take your knee and pull it to your chest. Yes. Knee to your chest. Good. And then I'm going to have you lift up. Okay, push down. Good. I'm going to check calf refill. I'm going to hold your toes and look for less than 3 seconds. Very good. Okay. Awesome. Looking good. And I'm going to have you sit up. And I'm going to check your patellar. So cross your legs for me. Good. Next leg, cross your leg for me.